does not have to be a progressive and debilitating condition. You can take action and you can take charge of your diabetes. In this session, we'll review the following: what is diabetes burnout, why diabetes occurs, and strategies to get past diabetes burnout. Our presenter for the hour is Dr. Esther Onyoni. She is a pharmacist, aspiring functional medicine practitioner, and a certified health and life coach. She works with people living with diabetes who are struggling to keep their numbers and their energy in control to successfully get their best readings, lose weight, and gain their energy. Dr. Onyoni's passion for finding a better way for her clients was sparked after over a decade of practicing as a pharmacist. She took care of people living with diabetes and other chronic conditions and noticed that they were on multiple medications. Their medication list kept getting longer each time they saw the doctor, in fact. And some medications were given to treat side effects caused by other medications. That sounds very familiar to me. Her mission is to educate and inspire people living with diabetes to be active participants in their health. We are so excited to hear from you today. Thank you so much, and the floor is all yours.
Thank you, Keisha. Welcome, everyone, to this session. So I saw last year, according to the summit last year, we saved your seat at the table, and this year we're giving you the microphone. So thank you. I'm taking the microphone, Keisha. I'll go ahead and share my screen and welcome everyone to the summit. So today I'll talk about diabetes burnout and how you can get your motivation back and be in charge of your diabetes. So that when one is diagnosed with diabetes, it is not a dress rehearsal. This is not the time when you start picking and choosing what you need to do about this condition. This is a time when you know that you need to do what you need to do to take control or take charge of this condition. Once you're diagnosed, you know that you do feel exhausted, but don't take that as a reason to sit back. You want to take charge. And in our current medical system, what happens is you're diagnosed, you're given medication, and medication upon medication, of course, and then it just gives someone an idea, or just it makes them think that the only way to take control of this condition is to take medication and you'll be fine. But I want to encourage the idea that you can actually take control and be in charge by putting more than medication, but adding on lifestyle changes. And so it is important that one keeps their diabetes under control earlier on before it's too late, because the condition does not stop if you stop taking care of yourself. And it's important for one to put in place an effortless way or lifestyle that will help them keep their condition under control. So some of the questions I get from my patients are that maybe they'll ask, I don't know what my doctor sent, or they'll say, I don't know what my doctor sent. So it kind of tells you that they are not getting the full benefit of their hospital or doctor's visit, because they're at the point where now they don't know what they are supposed to be taking, or they will ask something like, what is the best medication to take for over-the-counter medication to take for the diabetes? And we know that there is no magic bullet for that. And then they might also say, maybe they do for a refill, but they'll say, I have plenty of medication on hand, so maybe they're not taking their medication. And then another one that I hear most is a lot of people not being able to go and see their provider because of the current situation with COVID, and maybe they can get a tele visit, and sometimes technology is an issue. And so those are some of the things that can get in the way and have somebody lose control of their condition. So my number one goal with our time together here is to just show you how diabetes burnout or just the overwhelm of being diagnosed affects your loved one's care, it can affect your care and your management, and to show you that there are steps that can be taken to keep this condition under control. So before I continue, I'll tell you just a little bit about myself. So I've been there. Well, not in the idea that maybe diagnosed with a chronic condition, but I've been there in what you'll hear in my story, where the overarching theme is that I was not always that person who speaks up for herself. I was not the person who I didn't speak up, so I did not get heard, or at least I didn't feel like I was heard. And then I had the fear of asking questions. And what that led me to do is to feel stuck. I felt stuck. I always thought that I did not have much to offer, but that is probably not true. So my journey begins actually when I was younger. As a child, I had parents who argued way too much. And we were trained or taught to never interrupt whenever our parents are speaking or our adults are speaking up. And so you see how that would lead you to be that person who doesn't speak up, because you never know when it's the right time for you to speak up. And then I went on to boarding school, obviously, because the arguing parents didn't think it was a good environment for me to be at home. And so what that did is it made me hide even more, because now I don't want people to know my situation at home, and I'm more worried that I could be bullied in being alone in boarding school. So what that did is make me hide even more. So I grew up just hiding in plain sight. I was never the person who would speak up, but I mastered the art of hiding in plain sight. And in my own thinking, obviously, I thought that I succeeded because I did not get my parents to punish me. I did not get the bullies to bully me in school, and graduated from obviously college, from high school. I did all of that. And this is just a picture of me at my graduation from pharmacy school. So at least that was my version of success. And I went on to be a mom, I am a wife, I am a pharmacist, an entrepreneur. I am a diabetes health coach, and I like to be a patient's advocate. So I advocate for patients, and during my free time, I like to enjoy a puzzle or two. Sudoku is my favorite. And also I like to travel. So at least I thought I had succeeded. But what had followed me is that I had dimmed my light and no one could see me. And I was not the person, still not the person who would speak up for myself. And because you're not speaking up, obviously you're not being heard. And if you're not being heard, you actually feel stuck, and you probably just hide some more. And so I had to go back to the drawing board and decide how I was going to solve this problem. And so how I did that is by first recognizing that I had more to offer to the people around me. As I practiced through my adulthood, I saw that I had a lot to offer that I was not offering. And so I surrounded myself with people who would cheer me on, who had similar goals and encouraged me to speak up. And I built a coaching business that would help me show others how to speak up for themselves. And for me, it was people who are living with diabetes, because these are the people I encountered in my practice on several or just about all occasions. And they seemed, at least from the way they asked questions, they needed someone to help them speak up or speak for themselves. They always were not satisfied with their providers' visits. They had more questions than answers. And so they needed someone to help them speak up. And I thought that's one way I could support them instead of the current status for them, which was them just waiting for whatever the doctor or provider prescribed, and then they just went with the flow and not knowing that they could actually just speak up for themselves. So you may ask, why diabetes? Again, this is from my observations at my practice. I saw individuals who are taking long lists of medications, and all I could think was how can I just hit the reset button with them? They just needed to hit the reset button, because sometimes these medications, some medications were being taken to get away from, or at least to treat the side effects that were caused by other medications, or to treat every single symptom when there could be other ways that they could be addressed. Other challenges I saw were that people are not taking their medication, and this was due to maybe they had run into side effects from trying that medication and they were not ready to go back. Or even this is the time after the diagnosis that they thought that now they want to try a new lifestyle intervention that they had put off for a while. And you see, you don't want to do this because that delays your treatment or management of diabetes. And when you don't manage your diabetes, that's when you end up having complications. And then the other thing I observed is that a lot of individuals did not know what to do after their diagnosis. They were stuck in their analysis paralysis, So now they need to know what they need to eat. They need to put in their physical activity. They need to implement whatever lifestyle change, because all the doctor told them was, you need to change how you eat or you need to work out some more, but there was no explanation of how that could be done. And so they were stuck. Sometimes they just did nothing, and that, as we know, would lead one to be very overwhelmed, and that's how the diabetes burnout comes up. I have a question for you. Diabetes, or at least is this true or false? Diabetes causes blindness, kidney disease, amputations, causes neuropathy and other complications. Is this true or false? So if you answered false, you're right, because it's actually not diabetes that causes these issues, the complications. It is the poor management of diabetes that can lead to complications. And that's why we need to catch it and take care of it and not let it get out of control. And so I like to get in my soapbox and talk about how diabetes does not have to be a progressive and debilitating condition. Because if we take it this way, if we take it as a progressive and debilitating condition, then we're allowing ourselves to be okay with the status quo, or the current status quo, where people are just treated per protocol, and there's no follow-up in terms of lifestyle modifications that they can make. So I like to say that it does not have to be progressive and debilitating. And so I'd like to say thank you for joining me here today. We're going to learn about diabetes burnout, why it happens, and some myths that come with it, and some strategies that can be taken to overcome or get past diabetes burnout. So when one is diagnosed with diabetes, they now need to be on medication. They need to make sure that they have their supplies on hand for checking their blood sugar. They need to check their blood sugar more frequently. They need to know how to cook and eat healthy meals. They need to make sure that they're getting their eyes checked, their feet, And then it's all of this in addition to their regular routine that they need to balance. Now you could see how this can get someone to be very overwhelmed and less likely to follow through. So diabetes burnout then is when someone gets to a point where they quit. They just quit taking care of themselves. They quit taking care of their condition. And so because now their condition feels like this full-time job that they dislike, they did not ask for it, but it's just there. And so by the time you get, or one gets to be burned out, they would have had early signs. It's just that we rarely look at the signs that are leading us there. One of the signs is emotional exhaustion. So this is where there's no amount of rest that gets you feel rested. You feel fatigued. They feel they have insomnia and get forgetful. And that's one early sign. And then there's also just feeling or having a negative viewpoint about their condition. So having cynicism. And so they are very isolated. One gets very isolated and gets or starts to feel lonely. And this does not have to be the situation. I mean, people, when someone is diagnosed with diabetes, they're diagnosed, but they're not defeated. Another early sign of burnout is reduced self-efficacy. Basically, where someone gets to a point where they neglect their own care for their diabetes, they become hopeless. So how do we, why does it happen? Well, so for the most part, the very first thing you would say is that when one gets results that are very discouraging despite their efforts. So an example of this is someone maybe would have a new blood glucose meter and they check a new blood glucose meter, and they decide to check their blood sugar regularly, but they can't figure it out. They constantly are not able to figure out this meter, and they get discouraged despite their efforts. They kind of feel like they failed. Or maybe someone starts a new exercise routine, and what happens is a month in, they only lost half a pound. You could see how that's discouraging. Or even starting a new medication where now they've chosen that to have their condition under control, and they start a new medication. But then what happens is they have side effects that they cannot get past, and that gets discouraging. And then the second reason why burnout could happen is that diabetes can be a 24/7 obligation. So basically, when someone goes to sleep, if their blood sugars are high, they're up at night using the bathroom, they're unable to sleep well. If they need to if they want to go to, let's say, a restaurant to eat, they have to plan. What are they going to eat? They can't just pick up and go. Maybe calling ahead and find out what the menu is. It's the extra things that they really have to do in this situation. If they have to go to a party, they have to figure out what are they going to eat, or is this the time they're going to just let their progress slide. And then there's just so much to do. Okay, you're diagnosed, you got to find your diabetes supplies, your medications, you got to make sure they have refills, you got to check your blood sugars frequently, make sure you're eating a healthy meal. It's all of those things that keep piling up that make one feel that they cannot continue. And then also there is the stigma that is diabetes, where when one is diagnosed, now they feel as though they have completely lost control of their life, and they stop taking care of themselves. But it's a stigma. It's not like they did something wrong to have the diabetes, but they are at the point where they really need to take care of their condition. And some of the things that can lead us to getting burned out, which of course burnout can happen to anyone, but when it affects your diabetes, you want to make sure you're on top of it. Some of the risk factors is one of them is not having a clear plan in place of what are you going to do when you start feeling that you're losing your zeal to take care of yourself. So not having a plan in place of what goals are achievable or what is possible, that can increase your risk of being burned out. Not believing in yourself. So you start saying things like, I give up, I'm a failure. Those are things that can increase your risk of feeling or being burned out. And then also just having unpleasant feelings, feeling depressed or frustrated about your condition to the point where you stop taking care of it. And this is one place we do not want to go. So, are there myths about burnout? Yeah. Some myths that come along with burnout is that when someone is diagnosed, burnout comes with the territory, but it does not have to. That is not true. It's something that you can plan ahead so you avoid getting there. If it was so important, then the provider should have discussed about it. See, the truth is, when you go to your doctor's visit, there is not enough time to talk about this or address all of this. So it is important. It happens when you don't see it coming, but it does happen, and the doctors don't always address it. And you can do it on your own. This is a really huge myth, because if you were able to do it on your own, then you would have done it on your own. But here we are, if you're diagnosed, you do need the help. You don't have to feel like you need to do it on your own. And stress and burnout are the same thing. The differences are not subtle. This is not true. So I'm going to discuss some of the differences between stress and burnout. So when someone is burned out for when someone is stressed out for a long period of time, they can end up feeling burned out. So, but stress is when someone is overengaged. I'm sure we all have felt that in our lifetime. You're stressed out about something, so you're thinking so much about it. You pinpoint your brain to that. Your emotions are all about whatever that thing you're stressing about. That's when you're stressing about something, or that's stress. But when you're burned out, you're not engaged at all. It doesn't matter. Your emotions are blunted. You're not doing anything about it. So with stress, you lose your energy because you spend so much of it thinking about whatever that thing is. But when you're burned out, you've lost your motivation. So that is the difference there. And we want to do whatever we can to avoid getting to a point where you lose your motivation, because whether you lose your motivation or not, your condition continues to progress. So I said all that to say that you can actually manage your condition. So now I will talk about some strategies that you can put in place to help manage, or at least get past, diabetes burnout. Before I do that, I want to say that burnout also occurs at any time. So it's something that can occur at maybe this year, and a year from now, it might occur again. It shows up at any time. It shows up in any way. Anything can trigger it. But again, planning ahead is what helps us prevent it. So what are some strategies that you can put in place? So the first strategy I like to tell patients is knowing the ABCs, all right? So knowing your A1C, which is the reading that the doctors get from people who have diabetes, to give them an idea of their diabetes management, where their blood sugars have been, their numbers have been in the past 2 to 3 months, and then knowing the blood pressure and the cholesterol. And the reason you start here is because most of the time you actually already have this information from maybe a previous doctor's visit. So you don't have to go looking for doctor's appointments to get the numbers. You could go with what you already have. And when you're burned out, you want to do as little as you can to start getting yourself back into motivation. And having the numbers you already have and going from, you can use those as a starting point. So first strategy is knowing your ABCs. And then from there, you can identify your barriers and problem solve. So an example here is if, like I said earlier, if someone just started using a new blood glucose meter, well, they actually just picked it up. They probably never started using it because they thought that it's difficult to use. So I've run into situations where someone will call me and tell me 2 to 3 to 6 weeks after picking up their meter that they never started using it because they can't figure it out. So that is a barrier. They don't know how to use it. And we can problem solve by offering the help to help them know how to use their meter. Another example would be if someone's taking a medication and it's causing all the side effects that they're experiencing, that is a barrier for them to continue taking care of their condition and taking their medication. And what you can do is problem solve by either changing the medication, changing the dose, or just letting somebody know that this is the problem that they're experiencing. So after identifying the barriers, we can put in place a plan for action. And this is where you put in very specific actions, very small, very specific. An example of this could be encouraging someone to check their blood sugar first thing in the morning when they get up to know their fasting blood sugar numbers. And maybe they could do this for just 1 week. If they do it for 1 week, they'll have an idea of where their blood sugars run. And you would find that from there, they'll figure out something. They'll start doing something about it. Another example of this would be for a plan of action would be maybe choosing to take or eat breakfast every morning, at least within 1 hour of waking up for 1 week, because that way you reduce the risk of running into the highs and lows where your blood sugar dips and then you reach out for an unhealthy snack, and then now your numbers go up and you're in this roller coaster. So if you choose to plan this for a week, it gives you an idea of how much control you can have of the condition. Another strategy that can help move forward is acknowledging what is going right. So if you put in place a plan that you eat your breakfast every morning within 1 hour of getting up for 1 week, you want to acknowledge that when that has happened, because again, you would have seen the results and you would be encouraged for sure. And then taking a break. Well, this can be controversial, I want to say, because a lot of people say that if they take a break, then they will get their management of their diabetes off track. But if you plan your break so that it is safe, it is time limited and restorative, right? So if you're planning to maybe indulge in something you haven't eaten in a while, and you can count your carbs through the day and know that when you indulge later on, you're going to account for the carbs. And if your insulin or your blood sugar spikes, you were prepared for that and you had a plan in place. Maybe you were planning to go for a walk later on to help that come back down. And that would be one way of taking a break and having it feel very restorative versus feeling very restricted. Another strategy is to, like I said earlier, you don't want to do this alone. So you want to see who is cheering you on. You want to know who is in your circle. Is it your family? Is it your workmates? Who's going to remind you to check your blood sugars regularly? Who's going to help you engage in physical activity or even come with you to doctor's appointments? Because this is one way that, support is one way you can get out of feeling burned out, because that way you're not feeling alone. And then having hope is a strategy. You don't want to get to a point where you're saying it is too late for me, or there's nothing I can do. Just have hope. Small changes lead to big results, or at least in the coaching world, they say small hinges swing huge doors. So have hope is a strategy. So I want to share a recent a story from a recent client of mine who had reached out to me because she was feeling burned out. See, she had started a new medication to take care of her condition. However, it was giving her a lot of side effects. And she stopped taking it. And she told her doctor. But being in the current status where people are not able to go to the doctor as often as they should, maybe a lot of telemedicine, her doctor was not available, and whoever other doctor was covering prescribed something else that did not work for her either because there were side effects. They decided they were going to give her an injectable medication. However, she did not want to do any sort of injection. So she was against that completely. And she reached out to me because she said she needs to start changing her lifestyle, and she needed help with that. Upon further workup, we found out that she had also taken up a caregiver role for her husband who had had a stroke. And what happened is she was worried about what her family would say, because she is a caregiver. She does not get sick and she cannot stop taking her medication. And so this is what we found out is that she had a poor support system. And that's where we started. How is she going to get support? And then also just how is she going to get a medication that's going to work for her? Because if her blood sugars are already high, she does need the medication and she can implement lifestyle, but she definitely needs her medicine and she needs a support system. And so we worked on that. Her family started getting involved in her role of helping her take care of her husband so she could actually have time to herself. And she's still in the hunt for a medication that's not going to give her side effects. I suggested a few medications to her doctor, so that is yet to be seen. But it was exciting to see that at least support was in place for her. All right, so this is how you can contact me. So, but before I finish, I want to say that if one gets past burnout, what is possible? So what is possible is that one becomes an advocate for themselves, for their own health, and they're in charge of diabetes. So I hope that you enjoy the rest of the summit. If you want to reach out to me, these are my contacts, and you can find me on social media as well. And talk to you guys later.
Thank you so much, Dr. Onyoni. You had some really great points in your session. Yes, it was very informative. Thank you so much for that comment. One of the things, before you take your slide down, I always have speakers go back to a slide. Can you go back to that comparison where you compared the difference between stress and burnout? And I'd like people to take a picture of that just for their own, personal information. And even if you want to share it on social media, I think it's really important that people understand, most people can deal with stress. Like, there are different layers and different levels. And I think for the most part, most people deal with some stress, whether it's positive stress or negative stress. But when we're talking about burnout, this is a totally different level where you just don't, you've just given up. There is no hope.
Yes.
There is no motivation. I'm not checking my blood sugars. I don't even want to, I know they're high. I don't even want to know how high they are. And I'm just so frustrated with the situation and everything else that's going on with my life that I basically just check out. And so please take a heed of all of the strategies that she shared with you in this session, because you really want to notice those signs of stress that are leaning toward burnout, so you can make sure that you put things in place like she mentioned, and find the right resources and support and health coaches like herself, so that you can make sure that you don't get to that point. Because I've worked with lots of patients that have experienced, of course, stress, but burnout as well, and it is not pretty, right? But you, like you said, you can get help, and there is support and resources. So if there's any questions, we've got a few minutes. Go ahead and put that in the chat so we can answer your questions before we end the session. I actually think, I can't remember if this was a 30-minute session or not, but it doesn't matter. It's been a wonderful session. Thank you so much. Doesn't look like there's any questions, but this will be converted into a replay, and that replay will be available tomorrow. So that chat will be monitored. If there's any questions, you can put those questions in at that time. Any last words, or can you tell everybody where they can find you on social media if they want to connect with you further?
Yes, so I'm on Facebook and LinkedIn, and I have a group on Facebook that they could join if they wanted to have more support, because I train individuals in that group. I give weekly, like a lesson each week. And then just email me in that last slide as well. Oh, yeah, I stopped it accidentally.
That's okay. What's your email address?
Onyoni@gmail.com.
Onyoni. Let me put that in the chat too.
Sorry.
Onyoni at, what was that?
Gmail.
At Gmail. I think I spelled it right. Oh, I got it.
There you go.
Awesome. Well, thank you again so much, Dr. Onyoni. Everybody, see you in the next session. The next live session starts at 5 p.m. So hope to see you all there.